Hello, my name is Madison Smith. I'm a student nurse at the University of South Alabama, and today I'm going to be performing my NG tube checkoff. So here's my ID, and now I'm going to scan my room. Okay, so the first thing I'm going to do is go ahead and measure my NG tube of my live patient. So I'm just going to do that really quick before I do my checkoff. Okay. Now for this, I would wear gloves, but I'm not going to today. I'm going to grab my dog ear tape that I have with me, and I'm going to measure from the tip of her nose to her earlobe, the top of her earlobe, to the xiphoid process, which is right here. And her number was 52, so I'm going to put my dog ear tape on the 52, and that is where I'd insert the tube 2. Okay, so now I'm going to record my video now, my checkoff. Okay, so I'm going to put this back in here so that way I can start my checkoff. Okay, so the first thing I do when I walk into the patient's room is greet the patient, and I'm going to perform hand hygiene. I'm also going to tell the patient about the procedure we're going to do today. So Ms. Jones, today we're going to put in an NG tube. So I'm going to get the patient order form, and I'm going to, come closer. I'm going to do the medical order, and I'm also going to check hospital policy and do the 2 patient identifiers. So Jaguar Jones, I'm going to do the medical ID number, 417-6352, 417-6352, allergies penicillin, and I'm also going to ask if there's any other allergies that are not present on the care form. Okay, the next thing I'm going to do is I'm going to make sure I have all my supplies. Then I'm going to put my goggles on. And now I'm going to raise the bed to a working height, lower the side rails, and make sure my patient is in a comfortable position. Then I'm going to put on my pulse oximetry, and I'm going to check vital signs, and I'm also going to check bowel sounds. Okay, so now that I've checked all bowel sounds, I'm going to verbalize that if anytime during the procedure that the patient's oxygen saturation decreases or their vital signs change, I would stop inserting, and then I would wait until the patient's stability is determined to continue. Okay, so the next thing I'm going to do is I'm going to make sure the head of the bed is in high Fowler's position, as well as I'm talking about the signaling cue with my patient. So just a signaling cue as simple as raising her hand when she is in pain and really wants me to stop the procedure. Okay, so the next thing I'm going to do is I'm going to get ready. I'm going to get my NG tube ready, and I'll have my tape pre-made. And since I've went ahead and measured my patient before, I have the dog ear tape on my tubing. But I'm going to get my water-soluble lubricant and put a little bit on my, and then I would throw this away in the trash can I have below. Okay, then after that, I'm going to get my syringe and I'm going to prime it. Okay, and that's done. So the next thing I'm going to do is put on my gloves. Okay, now that I've put on my gloves, I'm going to get the patient to assess their patency. So they just hold one nostril closed and breathe, hold the other nostril closed and breathe. And I also clean the nose with soap or water or an alcohol prep wipe and pat dry. Okay, so after that, I'm going to put a towel down my patient. I'm going to remove the pulse ox so that I can see it throughout the procedure, as well as the basin and the cup of water with a straw. Okay, so this is my suction, so I'm going to go ahead and put it right here. I'm going to use a straw today. Okay, the next thing I'm going to do is I'm going to grab my tubing. I'm going to coil it up and then release. And I'm going to put about 4 inches of lubricant on the end of my tubing. Okay, so now I know it is lubricated and it's okay to put into the patient's nose. Okay, so I'm going to get the patient to tilt their head back, and I would insert it with the downward part in first, and I'm going to go in towards the nose. And I would time it on inhalation and just get the patient to relax. I'm going to go until I get to the nasopharynx, and once I get to the nasopharynx, I can get the patient to relax and tilt their head forward, as well as take a sip of water or dry swallow if they're NPO. Okay, and while they're doing that, I can advance it 1 to 2 more inches while gently rotating 180 degrees. And while I'm doing that, I'm going to keep on going until I reach the dog ear. Okay, and once I reach the dog ear tape, I'm going to hold the tubing. I'm going to place the other part in the basin, and I'm going to grab my temporary tape and place it on my patient's cheek. That way it is stably on there. Okay, and while I was holding it, I'm going to verbalize that if the patient coughs, goes into respiratory distress, or their oxygen saturation is less than 95%, I would stop the procedure. I'd pull back to the posterior nasopharynx and wait till the person got to regular breaths, regular respirations before I continued, and I get the patient to swallow while inserting. Okay, so now that that is connected, I'm going to grab my pen light and my tongue blade. This is what I'm using as my tongue blade, and I'd look in their mouth and make sure that the position is correct. Put that down. I'm also going to look at the exit point, which is either right there, and make sure that that's present. The next thing I'm going to do is assess or put the syringe on the end of my tubing. Okay, and then put it above my patient's stomach. There are 3 ways that I can check the placement of the tubing. 1 is by aspirating the gastric contents, 2 by assessing the pH, and 3 by a chest x-ray if it is ordered. Okay, the next thing I'm going to do is I'm going to move on to putting on my fancy tape and my label on my nose. Okay, so I'm going to take the syringe out. I'll place it down here. I'm going to cap it. Okay, put it back up here. I'm going to clean it with the alcohol prep wipe as well. I'm going to clean it with the alcohol prep wipe before I were to put the fancy tape on. I'm also going to go ahead and take off the dog ear tape. I'm going to hold it, and I'm going to go ahead and put the fancy tape on the nose, as well as connecting it to the tubing. Okay, and after that is connected, I'm going to get my label, and I'm going to put the patient's name, the time, and the date, and I'm going to put it across their nose. Okay, once that is done, I'm going to demonstrate how you do suctioning for this because it is put in correctly, and there's no tension in the tubing as well. So I'm going to demonstrate how you do suctioning. So this is my suctioning I'm using today, but you connect it and then lay it above the patient, as well as turn on the wall suctioning, low wall suctioning, so whatever is ordered. Take that out. And then this is how you cap the tubing, and this is the blue pigtail, and whenever you have it loose, always goes above the stomach. Okay, so now that I've done that, I'm going to go ahead and cap it just so it's in place, and I'm going to get rid of all of my materials. Okay, I'm going to take off my gloves, perform hand hygiene, and I'm going to raise the bed, lower the bed, put 3 of the side rails up, make sure the patient has the call light, and put the head of the bed to 30 degrees, and no lower than 30 degrees. I'm also going to take off my goggles. And now I'm going to move on to documentation after I perform hand hygiene. So for documentation, I document the type and the size of the NG tube, the color, the amount, the characteristics of the secretions that come up, the patient's response. I'm also going to document where I inserted the tube, which would be the right nair, how it was inserted, how it was attached, and how it was performed. And now I'm going to move on to taking the tubing out. So the first thing I would do is perform hand hygiene, look at my parent order form, and check the medical order as well as hospital policy. Perform hand hygiene once again. I'm going to put on my gloves and my goggles. And I'm going to place a towel over my patient's chest. Okay, once I've done that, I'm going to check bowel sounds one more time, as well as vital signs and O2 saturation. Okay, so now that I've done that, I'm going to move on to taking the tube out. I forgot to mention this in the first part, but I would clip the tube to the gown. So that would be one of the first things I do when I take it off is unclip it. Then I would take the tape off and hold it. Okay, now I'm going to bring this around. I'm going to kink the tubing and slowly pull out. Get the patient to take a deep breath and hold as I pull out, and kind of let it all fall out onto the towel. Okay, so now that I've done that, I'm going to verbalize that I would measure any secretions or any drainage. I would throw this away as well. Measure any secretions or drainage, perform oral hygiene, as well as document. I'm going to take off my gloves, perform hand hygiene, and as well as take off my goggles. And that is the end of my check off. Thank you.